Hello everyone, today we will see about the definition of the absolute bioavailability and relative bioavailability and the basic difference between both of them. When the systemic availability of a drug administered orally is determined in comparison to its intravenous administration is known as the absolute bioavailability, as it is denoted by a symbol F. Its determination is used to characterize a drug's inherent एब्जॉर्प्शन प्रॉपर्टीज़ फ्रॉम द एक्स्ट्रावेस्कुलर साइड. इसमें क्या होता है, ओरल ड्रग का जो है इंट्राविनस जो भी ड्रग हम एडमिनिस्ट कर रहे हैं उन दोनों का कंपैरिजन होता है. रिलेटिव बायो अवेलेबिलिटी, व्हेन द सिस्टमिक availability of a drug after oral administration is compared with that of an oral standard of the same drug, it is denoted by symbol FR. It is used to categorize absorption of a drug from its formulation. Here is the difference between both of them: absolute bioavailability and relative bioavailability. Definition, first of all we will see it. Absolute bioavailability, it compares the bioavailability of a drug from an extravascular route to the same drug given by the IV route. Next, relative bioavailability, it compares the bioavailability of a drug from two different extravascular formulation. Reference standard in the absolute, it is the IV, whereas in the case of the relative bioavailability, it is the extravascular formulation. The purpose of the absolute bioavailability is it measures extent of systemic absorption compared to IV route. In the case of the relative bioavailability, it compares rate and extent of absorption between non-IV products. Absolute bioavailability, it is used for new drug development, evaluating oral drug delivery efficiency. Relative bioavailability is used for comparing the generic drugs versus branded drugs. It is also used in the case of the any change in the formulation or changing the formulation. It is generally used for changing any formulation. Typical oral route comparison, in the case of the bioavailability, it is oral versus IV, or we can say intramuscular versus intravenous. In the case of the relative bioavailability, here is the comparison of the oral tablet versus the oral suspension. Next, what do you understand by the sink condition? In dissolution testing, sink condition refer to a state where the dissolution medium has a sufficient volume to ensure the drug dissolves completely without reaching saturation during the test. When the drug is ingested and a longer concentration gradient exists, thereby acting as a driving force for absorption. Once the passively absorbed drug enters blood, it is rapidly swept away and distributed into a much longer volume of body fluids. This condition is maintained. Such a condition where concentration of drug at the absorption site is much greater than that of the concentration of the drug in plasma, and we can say it is a sink condition. We will see about the in vitro in vivo correlation. The definition of the IVIVC according to FDA is it is a predictive mathematical model describing the relationship between in vitro property of a dosage form and a relative in vivo response. USP defines IVIVC as the establishment of relationship between a biological product or a parameter described from a biological product produced by a dosage form. In general, the definition of the in vitro in vivo correlation is it is defined as a mathematical model which describes the relationship between in vitro and in vivo properties of a drug product so that in vivo properties can be predicted from its in vitro behavior. Objective of the IVIVC, it ensures that there should be a batch-to-batch uniformity in physiological performance by utilizing in vitro experiment data. It serves as a tool in developing new, effective and safe dosage form. It assumes great important, especially for such formulation which maintain drugs having narrow therapeutic window or variable therapeutic response. IVIVC can be achieved by using pharmacological consideration based on clinical observation, semi-quantitative correlation based on drug blood level or urinary excretion data, quantitative correlation arising from absorption kinetic and calculation of in vivo absorption rate constants. Different methods of IVIVC are: first is the simple point type. The percentage of drug dissolved in a given time is correlated with that of the bioavailability of a drug product. Comparison of profiles in vivo data. Plasma concentration time profile. Pharmacokinetic parameters like AUC, Cmax, Tmax. Percentage drug absorb time profile. Statistical moment analysis. In vitro percentage drug dissolution profile. Different stages in IVIVC. First stage. It is high category of correlation, we can say. In this, there is a point-to-point relationship between in vitro dissolution rate and in vivo rate of drug from doses form. Superimposable absorption rate curves and mathematical description are similar. Alternative to in vivo method, manufacturing method changes, formula modification preferred without in vivo data. Stage 2 utilizes the principle of statistical movement analysis. Mean in vitro dissolution time of product is compared to either mean in vivo residence time. No point-to-point correlation, not reliable to justify changes in manufacturing or formula changes. Stage 3, it is a single point correlation. It relates dissolution time with pharmacokinetic properties like AUC, Cmax, Tmax. It helps to develop formulations. Stage 4, amount of drug dissolved at different time intervals can be correlated with many pharmacokinetic parameters. Scale up and post approval changes can be made to the formulation. Next is the factors affecting the dissolution test apparatus on rate of dissolution are: first in this is the agitation, second is the sampling probe, and the third one is the steering element alignment. In the case of the agitation, the speed of agitation generates a flow that continuously changes the liquid-solid interface between solvent and drug. In order to prevent turbulence and sustain a reproducible laminar flow, which is essential for obtaining reliable results, agitation should be maintained at a relatively low rate. Thus, in general, relatively low agitation should be applied. Basket method 100 rpm, paddle method 50 to 75 rpm. Sampling probe position, it affects the hydrodynamic of the system. Concentration varies at different places of the system. USP states that sample should be removed at approximately half the distance from the upper surface of the basket or paddle and surface of dissolution medium, not closer than 1 cm to side of flask. Stirring element alignment. The USP states that axis of stirring element must not deviate more than 0.2 from the axis of the dissolution vessel. Studies indicate that significant increase in dissolution rate up to 13% occurs if shaft is offset 2 to 6 mm from the center axis of the flask. Tilt in excess of 1.5 may increase the dissolution rate from 2 to 25%. Here is the methods of the dissolution testing. These are the some of the compendial method of dissolution. ये जो है USP के अकॉर्डिंग इनके methods of dissolution testing है. Apparatus 1 है, इसमें टोटल 7 apparatus होते हैं. इसमें जो पहला है वो क्या है, रोटेटिंग बास्केट है जिसका यूज़ हम लोग टैबलेट कैप्सूल्स के लिए करते हैं. सेकंड जो है पैडल है जिसमें ड्रग प्रोडक्ट्स लाइक वी कैन से टैबलेट कैप्सूल्स मॉडिफाइड ड्रग रिलीज डोजेज फॉर्म. Third is the reciprocating cylinder. Example in doses drug product like we can say extended release drug products. Fourth is the flow through cells products containing low water soluble drug. Fifth is paddle over disc transdermal drug products ointment gel. Sixth is cylinder transdermal drug product ointment gel. Seventh is reciprocating disc, extended release, drug product, transdermal patches. This is all about the summary questions of the assignment which I have explained here. Thank you.